as a Ministry of Health and Wellness, and we have indicated that we're in community transmission. Our approach, our efforts have to shift once we are defined or determined to have community transmission, meaning once the virus has spread throughout the population, where it can turn up anywhere involving anybody, and there's no immediate recognition of where it came from to that particular individual. In other words, not readily traceable to an index case or an original source. So there's a huge surveillance focus to monitor, because it is in monitoring you observe trends, and in the trends that you observe, you generate a response. Identifying and managing severe cases. So clinical treatment are now prioritized to those who need it most. Hospitalization will for those who require hospital care, those with severe symptoms, which means a ventilator or an intensive care unit or a high dependency unit. Preventing onward transmission is a big focus, meaning public education, getting persons to respond so that they are not passing on the virus, and do so the best we can through individual responsibility, public action, community engagement, and that's what the community health aides and so on are for. So that's a big focus. Alleviating strains on the healthcare services, so addressing the internal dynamics and functioning of our hospitals, providing support to our healthcare workers, expanding where we need to expand our healthcare services, informing and keeping the public informed on recent developments, getting their feedback, getting their testimonials as to how they deal or are dealing with the issues, and satisfying any inquiries or any doubts, fears, anxieties that they have, and reducing the overall social and economic impact of the virus. So really trying to ensure that while we live with the virus, we manage the spread as best as possible to allow Jamaicans to be in a position to continue to live their normal lives, work, play, all the other things that they are accustomed to, social and economic. So community transmission does not envision totally shutting down the economy. Indeed, it envisions managing the spread to ensure that the economy continues to function. Both have to coexist. Assume that all you come in contact with, even your relatives and close friends, are potentially COVID positive cases. And so wearing the masks, the physical distancing, the sanitization is absolutely critical. Bear in mind too that if you are infected, you should protect yourself and protect others around you. And if you have underlying conditions, hypertension, diabetes, renal issues, cardiovascular disease, or any other such issue, a doctor should work with you to determine whether you should have hospital care or you recover from home or from some other facility. The expansion of capacity, and in particular beds, COVID beds, is very much an important part of the plans going forward. And in fact, we have made substantial progress. We have confirmed the arrival of one field hospital. It will be located in the corporate area, and that field hospital will allow for an additional 80 plus or so beds. There's another that is being pursued, which will be a similar field hospital that would be placed in the center of the island, on the south coast actually. Yeah. And then there is a third that will be constructed in the west. So all told, we will add a fair bit of capacity to providing additional beds.